Hello, my name is Rachel Issaka, and along with Andrew Chan and Samir Gupta, I am thrilled to share our recent AGA clinical practice update titled Risk Stratification for Colorectal Cancer Screening and Post-Polypectomy Surveillance. So 5 things we want readers to take away. 1, based on the current evidence, risk stratification for colorectal cancer screening or surveillance should be based on an individual's age, their family history, whether or not they have predisposing hereditary colorectal cancer syndromes, if they've had prior screening or have other medical conditions that put them at risk for colon cancer, for example, inflammatory bowel disease. 2, individuals with a first-degree relative who is diagnosed with colorectal cancer should be considered at increased risk for colorectal cancer. And this is especially true if that relative was diagnosed before the age of 50. For those that don't have such history, they are considered to be at average risk for colorectal cancer. 3, individuals who are at increased risk of colorectal cancer must be screened by colonoscopy, whereas those who are considered to be at average risk for colorectal cancer can complete screening using stool-based tests, colonoscopy, or a combination of those tests, as well as other approved modalities by the U.S. Multi-Society Task Force on Screening. 4, when individuals are of the age of 75 years old and are trying to decide if they need to continue having surveillance colonoscopies because of a history of polyps, that decision needs to be individualized, and it needs to be based on the risk of the procedure to them, the benefit, as well as their own comorbidities. And finally, there are very exciting risk stratification tools that are emerging in the literature. Until those are, before those are used more broadly, we really need more real-world data that shows the populations that those are developed in, ensuring that there is adequate diversity, and also to understand how they work in diverse settings, diverse populations. Additionally, it would be important to understand the cost effectiveness of those newer risk stratification tools compared against the current standard practice. Thanks for tuning in.